Hello, everyone. I'm Andrea Kirsten Coleman from the Vision Impact Institute, and we have the amazing opportunity to sit down with Dr. Serge Resnikoff from our VII Advisory Board today to discuss the rising prevalence of myopia globally. Serge recently moderated a panel discussion on the topic of possibilities and probabilities of myopia at the 17th Annual International Myopia Conference in Tokyo, Japan. Serge, it's great to be with you today.
Good morning, or good afternoon, or whatever the time it is. I don't know.
Thank you for joining us. Before we dive into more about the conference, what insights have you gathered from your travels to better understand myopia from a global perspective?
Well, I think by kind of traveling around the world, what is becoming quite clear is that on the one hand, myopia is everywhere. But on the other hand, it is not recognized as a problem everywhere. And this is a matter of concern because it's particularly in the places where myopia is just starting to become on the rise, where it would be important to tackle it properly. So we don't need to wait until it becomes a public health problem everywhere.
So this past weekend in Tokyo, you moderated a panel of academics from universities around the world. How did this panel come together?
Well, I mean, this panel has been organized in order to kind of brief people about what the International Myopia Institute is doing. And it was kind of structured in two parts. The first part was about presenting and discussing the main findings of the white papers that have been recently published by IMI, and the second part of the panel was about discussing and presenting what will be the next steps for, say, the year or the 2 years to come, and particularly discussing what should be the additional white papers that the group should be working on. And I mean, a number of them have been selected, and this community of researchers and academics and experts will be working on topics such as high myopia in children, high myopia in adults, and particularly the complications of high myopia. An important topic, and a topic where I think the VI might have a particular interest, is about impact of myopia, both kind of social impact and economic impact. Another white paper that had been discussed and will be considered is about the environmental risk factors. And we have also decided to work on some preferred practices and guidelines for the countries where such guidelines are not existing yet. And last but not the least, we will be producing yearly updates so that people have an understanding of what has been the latest findings, the latest publications since the white papers have been published. So it's been a quite long and intense series of discussions.
You mentioned a community of academics. Why is it particularly important to get their perspective?
Well, because I mean, these are the people who are actually producing evidence and presenting evidence in a way that is understandable by everyone is particularly important. Because otherwise, science remain in scientific papers and not turned into action.
Right, and action is really what we need. You mentioned that the title of the panel to me is quite interesting. It's the possibilities and the probabilities. What key highlights stand out for you in those two areas when discussing myopia?
Well, I think the title was actually reflecting that kind of we know a lot, and a lot can be done right now. And B, there is still a long way to go, both in terms of research and also in terms of implementation and policy changes. So it reflects, actually where we are.
Was there one key message that came to the forefront over the course of the discussion?
Well, actually, it was not like one key message. I mean, from my perspective, it was much more like the convergence of discussions that was kind of coming together and focusing on the need to make the eye care professionals more aware of the existing solutions, and not only more aware, but also kind of applying these solutions. Again, one of the issue is that when you have scientists meeting together, it's very clear that a lot of science and evidence is existing, but this science and evidence needs to be turned into practices, into patients being properly managed, and that's still a big problem. And this is something that the people in the room were kind of realizing and trying to find a solution to that.
Well, so with the focusing of many people from all over the world on this one topic, do you see geographic regional differences in opinion appear related to the topic?
No, there is no major kind of difference in views. There is, I mean, a lot of common ground, a lot of consensus. There are, of course, some, when you talk with the people who are running research and the very specialized areas, yes, there will be some differences, but these differences are really minimal compared to the vast amount of knowledge that is being kind of shared. I mean, the knowledge that represents the base of what can be done in terms of serving the patients.
So throughout our conversations, you mentioned the need to turn evidence into action. That seems to me like a strong takeaway from the panel. There are 2 or 3 other takeaways that the group came up with?
Well, I mean, I think the strongest takeaway with the fact that solutions are available, and again, even though there might be some controversies in some aspects, but overall solutions are available. And the second point, of course, is that when you have, I mean, people that are involved in research meeting together, it's clear that more research is still needed on all fronts to delay onset of myopia, to further slow down the progression of myopia when it has started, and to treat complications. So it's not like we know everything about. We still need to further understand some of the mechanisms, particularly if we want to have more efficient solutions. But again, I mean, it's not because more research is needed that nothing can be done right now. And this call for action, I think that this is really what is important.
Was there anything that surprised you from the discussion?
I was not really surprised. I was more like kind of thrilled by the energy that was in the room, by the dedication of the people who were in the room. And I'm not talking about only the member of the panel. I'm mostly talking about the audience.
So for anyone advocating for good vision, like we do around the world, whether it's another organization like ours or one that's making policy decisions, or individuals that are making policy decisions, what would be your message to them after participating in this discussion?
Well, my main message would be that there is, I think, enough evidence to start working everywhere, including in places where myopia is not yet a massive problem. We should not wait until the myopia is becoming a massive problem to start implementing solutions that are existing. I think this is something that we have learned from other areas in public health, like, for example, the non-communicable disease, like cardiovascular disease, cancer, diabetes in developing countries. And for many years, people saying, "Oh, this is for rich countries only. We need to tackle first infectious disease," and that was not right. And I think we know that in terms of public health, you better start addressing issues in places where they're just starting, rather than waiting to become a massive problem.
So what can our Vision Impact Institute audience do to help spread awareness and to advocate for the issue? You mentioned not waiting for it to become a larger issue in certain places. Would that be one thing, or what else would you say?
Well, I think Vision Impact Institute can play a very effective contribution by disseminating the knowledge of the best practices. I mean, again, I mean, the issue is that we need to go out of this silo of the people with science sitting and knowing a lot of things. And then the eye care professionals that are still seeing myopia just an issue of prescribing glasses, where it's indeed about providing people with optimal optical correction, but it's also about delaying the onset and slowing down the progression. So contributing to the dissemination of knowledge, I think, is absolutely critical.
So it sounds like it's really just key to work from all angles on the issue.
Correct.
Well, thank you so much for your time, and thank you for joining the board of the Vision Impact Institute, which you did recently. And we really look forward to the collaboration and the expertise that you will bring to our board and to working with you in the future. So I appreciate your time on this call.
Thank you. It's a pleasure.
So thank you to all of our listeners. We really appreciate you taking the time to listen today, and we look forward to bringing you other conversations about the state of global vision health very soon. Until then, you can find us online at visionimpactinstitute.org and in social media on Facebook, Twitter, and LinkedIn. Take care.